Hey everybody, Dr. Strong here, and thank you again for watching this video. Today we're going to be talking about diabetics and then actually skin conditions that can indicate that either you're developing diabetes or that are common amongst diabetics. Now, we treat neuropathy here in the office, and what we see very commonly is people that have diabetes typically have peripheral neuropathy. And this is a really debilitating issue, and I really hate to see it because the outcome of that over the years is amputation, or people end up in wheelchairs, losing the quality of life. They're not able to go walk on the beach here in South Florida where we're located, or they're not able to go play with their grandchildren, and it's so sad. But the great news is that there are things that you can do to actually reverse not only diabetes, but neuropathy as well. I've made several videos talking about how we can actually reverse diabetes naturally, and go check those videos out. There is like a step-by-step. Here's what you need to work on first. Here's the second thing. It's in a playlist just called Reversing Diabetes. So go check that out if you haven't already. But what I want to talk to you about today is be aware of what your skin is telling you. Symptoms mean that something is going on. It's the alert system in your body saying, hey, something's happening. And whether it's pain, whether it's you have a headache, whether you're tired, whether you're fatigued, whether you have diarrhea, all of those are symptoms which correlate to something going on in the body. They are the body's alarm system. So one of the first things that we want to talk about is dry skin. So the first diabetic skin problem that typically people see is dry skin. Now, this can look like crackling of the skin. This can look like dandruff in the hair. So if you experience dry, itchy skin due to high blood sugar levels, then you really want to consult with your doctor. Make sure you're getting your blood glucose checked. Make sure you're getting your A1C checked, and just be proactive towards, the early warning signs and symptoms, so you're not having to spend like $200 to $300 on insulin shots and all of the diabetic equipment that comes with that. Now, if you notice that you have dry or cracked skin, then really take into account of your diet. Look if you're eating a lot of simple sugars, and then also getting testing can be super valuable. Now, the second problem that we see in diabetics, and that we're really worried about, especially when it comes to peripheral neuropathy, if people have cuts on their feet or on their hands, the likelihood of those getting infected is really high, because if you have diabetes, your ability to heal goes down drastically. So people with diabetes are more prone to skin infections. So if you notice that you have skin acne, if you notice that you get an infection or a pustule on your skin, that can be due to high blood sugar levels, because the bacteria in those pustules or in those infected areas, they feed off sugar. Now, this weakens the immune system, so you're not able to fight off those infections, and that can be really severe issue, especially if you weren't able to feel your hands or your feet and you get a cut and you get like a diabetic ulceration. That's typically what happens, is they get gangrene and they have to have that limb amputated, or else the infection will spread. So very scary stuff. But that happens when it's due to poor circulation and high blood sugar levels, which damages the vessels and the nerves. So you're not able to get oxygen and nutrients to those areas so that they can heal. Now, the third one is the slow healing of wounds. So if you notice, like you get a cut or a scrape and it's just taking it forever to heal, or it opens back up or cracks back open, that can go along with dry skin. You want to, like I said, go consult your doctor, see what your blood glucose levels are, see what your A1C is, and get on top of that. Now, what happens is most people will cut the bottom of their foot. It'll lead to that infection, gangrene, and amputation. So really pay attention to these signs, because they can be lifesavers. Another one is diabetic dermopathy. So sorry, that was a mouthful. But this is just when the derm, or the skin, is affected by the diabetes. This skin condition that causes brown scaly patches on the skin. We actually just saw a patient with this about probably 2 weeks ago, and they were just on the verge. They actually had to come in a wheelchair because it was so severe. But they had, I don't know if you've ever seen anybody, but their skin just looks brown, and it looks scaly, and it looks kind of like an alligator skin almost. And this usually occurs on the shins, and it's caused by changes in the blood vessels, and it's more common in people with diabetes. Now, if you're getting to this point where you're having this diabetic dermopathy, you really want to be proactive, because it's not very long after that. I can't tell you if it's 6 months or a year after that, but those people typically have to have amputation because it's just so severe. Now, the next one is diabetic blisters. So if you're having diabetic blisters, or if you're getting diabetic blisters, again, it goes back to the dry skin is causing the cracking, and then you're not able to feel your feet. So if you cut them open or they crack, they're not healing appropriately. And these are fluid-filled blisters that can appear on the hands, feet, and legs of people with diabetes. They're usually painless and go away on their own, but can be a sign of nerve damage. But I would say that if you're having those diabetic blisters, the susceptibility of infection, so everything that we've talked about beforehand, is like tenfold. And that can lead to them just eventually progressing up the leg or causing more pain than not. And the sixth one, so there are 9, so stay with me here. The sixth one is eruptive xanthomatosis, okay? So some big words here. Now, this is a skin condition that causes itchy red bumps on the skin, usually on the back of the hands, feet, and buttocks. And it's caused by high blood sugar levels, and it can be a sign of uncontrolled diabetes. Now, you may see people who have eczema, or they have some type of skin rash. Those can indicate that they either have an autoimmune condition or that they have a decreased immune system. Their immune system isn't working like it should. And so if you know somebody that's like that, even if you think that it's eczema, go get your blood sugar levels checked, because it can really save you a lot of hassle in the long run if you're trying to combat it with anti-inflammatories, corticosteroids, which can ruin your hormonal system. Then that can really save you a lot of trouble. The second one is necrobiosis lipoidica diabeticorum. Now, that's a skin condition that causes yellow, waxy patches on the skin, usually on the lower legs. And it's caused, just like we said, by diabetes. So if you notice that you're getting these yellow, patchy, kind of gross looking ulcerations or patches on the legs, then that can be a sign as well that you want to go consult your doctor and get that checked out. So be very careful. All of these are warning signs, and even though that some of them are fairly similar, they can all cause one another. So making sure that if you have the first signs, or if you have any signs of these, go get it checked out. Now, the eighth one, so we're getting close, is encanthosisnigricans. Now, this is actually a blackening of the skin, and it causes dark velvety patches on the skin, usually on the neck, armpits, and groins. A lot of the times you'll see these people will have skin tags as well, because skin tags are uncontrolled growth. So you can almost think of them as like a benign cancer, but high blood sugar is one of the biggest causes of skin tags. I have a video that talks about how to get rid of these and the underlying cause about skin tags. So go check out my videos. You can see where we talk about what skin tags are, what causes them, and then how to get rid of them naturally. So it's a really cool video. I highly suggest it. Or if you know anybody that has skin tags, go send that to them. But this is usually caused by high insulin levels and can be a sign of insulin resistance. I'm sure that you've either been in line with somebody, or if you've seen somebody that has like those dark skin areas around the neck or their armpits, or hopefully you don't see their groin, but especially the neck is like the most common area, then that's something that is a huge warning sign for diabetes, and you need to get it checked out. Now, the last one, just like I've already talked about, The ninth and final diabetic skin problem is skin tags. And these are small flesh-colored growths that can appear on the skin, and usually in the areas that the skin rubs together. So like we talked about, the back of the neck, the armpits, the legs, the groin area. And they're more common in people with diabetes and can be a sign of insulin resistance as well. So you really want to take in account what your body is telling you. Your body is very smart, and it has all of these warning signs before even something goes wrong that, okay, we can fix this, we need to address this up front. So with that being said, those 9 signs and symptoms are, I'll go through them one more time, are dry skin on the hands and the feet, skin infections on an arm or a leg, slow healing of a wound on an arm or a leg, diabetic dermopathy, which are fluid-filled blisters that can appear on the hands and feet and legs of people with diabetes, a diabetic blister, which can cause, infection, can be caused due to the dry skin. Then the next one is eruptive xanthomatosis, which is cause those little red itchy bumps on the skin. The next one is, it's the necrobiosis lipoidica diabeticorum. That one is the yellow waxy patches on the skin. Then we have the acanthosis nigricans. And then the last one is skin tags. So make sure you really go back and watch the video if you have any trouble, or if you think, oh, I'm not wanting to learn more about that one, or if you know somebody you want to share this with and like, hey, I think I've seen this on you before and I just want you to be aware of this, and send that over to them. But those are the 9 most common signs that we see that somebody may be diabetic or pre-diabetic, and it's really good to get it checked out. Now, if you enjoyed this video, please like and subscribe to my channel, share it with your family or friends. My mission is to help as many people as possible overcome their chronic health conditions. And if I helped you, please let me know. If you have any other questions, just comment below. And check out some of my other past videos. There will be another one around here somewhere, and I look forward to seeing you all next time. Bye-bye.